All right, welcome to Commissioner's Corner for November 2020. I'm your host, Scott Vargo, and I'm joined by County Commissioner Elisabeth Lawrence, recently elected Commissioner Elisabeth Lawrence, so congratulations on that. We're going to talk, as you might expect, about COVID and a number of different topics around COVID. So first and foremost, I guess, Elisabeth, you want to share a little bit about what our sort of current statistics are. We're taping on the 16th of November, so by the time you watch this, those numbers may have changed, hopefully in the right direction, but where we are now.
Yes, so now we're at over 1,100 cases total. Now that's since the beginning, but I think what's important to note is the majority of these cases out of the 1,100, we've really been seeing past October. After that Labor Day weekend, where we knew we would have a rise in cases as we've seen throughout all holidays, it never went back down. And if anything, it just continued to rise more and more. Let's see, I believe we've had some days that are in the 30 new cases a day. Yep. For the size of our county, I mean, that's alarming. We have really strong positivity rate, which is not good. We want to have a low positivity rate here, and ours has been over that 10% threshold often. It might come down a day or so, but we have not been able to sustain a 2-week standard of reduced case numbers or reduced positivity rates. So we have been fortunate here in Summit County that our hospitalization numbers are relatively low compared to other places within the state. But we have even seen a few of those throughout this, which has been surprising.
Yep, and more lately. And so we hear this from Amy Wineland, our public health director, often, that again, hospitalizations and deaths are a lagging factor. And so as you see those cases rise, it takes a while for some of those more severe cases to get to the point where you end up with hospitalizations, and hopefully we'll avoid deaths, but those cases come later.
Yes, that's right. And also for some people, this isn't one and done. They don't necessarily get COVID and then after 2 weeks, they feel better later. Yep. I know an employee in the restaurant industry that they had shared that they contracted COVID, and months later, they have still been sick because of it. And this is a very fit, healthy individual. And so I think that there's examples like that in our community. Sure, for many people, it is like a common cold. But what is troubling about this virus is it's not predictable, and we don't know. And so there are those risks associated in long-term effects, and that's why we really want to make sure that we prevent the spread, not only to save lives here in Summit County, but to make sure that our community stays healthy.
Yep. So I know that we've pushed the idea of the 6 commitments. What are the other, messages that we're trying to push out right now?
Yes, so I think a big one of that, and this is in conjunction with the governor's office, is to encourage people to work from home where possible. That's difficult. As I told some people yesterday, I'm an extrovert by nature, and I really gain energy from being around people, and I have really missed that in the office. It hasn't been, we haven't been that way in months and months and months. It just doesn't happen anymore. But I know that that's best. It's the right choice to make. But where possible, if people are privileged enough to have an office job or a job that they can work from home, I encourage them to do that. Certainly it's easier for all of us if we can work in our normal setting, in our office, we like routines, etc. But that's not necessarily safest. And I'm asking people to maybe give that up, commit to working from home when possible, and really come up with creative ways for staffs to be able to rotate schedules, etc. Because it's not only protecting ourselves and our neighbors and our coworkers, but it's protecting those frontline workers that don't have the opportunity to work from home. If you are a cashier at one of our grocery stores, you can't do that job remotely. You have to be there on the front lines. So how can we make decisions, those of us that have these office or work from home jobs, that we then are protecting the people on the front lines? And that's something we really want to get out to our community right now, as well as limiting contact to members of your own household. We talked early on about having a quarantine. We've had one, our next door neighbors have very small children, 3 under the age of 5, and they're very, very dependent on us. We've kind of adopted them, but currently that's not allowed, and we made a kind of heart-wrenching decision a few days ago that we were going to end our quarantine that we've had going since March. But it's really the right thing to do, as they are frontline responders, and we have to make sure that they're staying healthy, their kids are, we are, etc. And so maybe it's breaking up those quarantines that have served many of us in our community well since March. We're now going to break those apart and really encourage people just to stay with your own household. That's tough for Thanksgiving. Very few of us here have family, because Summit County is a place where so many people have moved from other places. And so often our neighbors and our coworkers and our friends, they are our family here. But we're asking people just to stay with your own household.
Yep. Yeah, and really tough. Again, the idea of work from home, the idea of just interact with your own household. It really does go back to your point of the frontline workers, emergency services personnel, hospital personnel, all of those folks. As we see this incredible surge in activity here locally, we put ourselves at risk for, are there going to be law enforcement folks available? Are there going to be hospital workers available? Are there going to be teachers available in the schools?
Right.
And so all of those things come down to, we have to really limit the amount of contact we have with folks outside of our household so that we can keep people safe and keep them available to go to those positions that are critical, that can't, as you said, work remotely.
That's a really great point. Especially, teachers, we want our kids to be in school, and we know that school can be a safe place because of all the precautions. But, if we don't have healthy teachers and staff that can be there, and bus drivers and all those people that help make the school day successful. But also, as I heard Governor Polis say a couple of days ago, it's not so much the hospitalizations that are going to overwhelm us immediately. It's the lack of personnel to work at those hospitals. And that really hit home, because if we don't have nurses that are safe and that could be in work, if they are sick, then they can't take care of people that really need it. And these are all of those things that we're learning now in the virus. And we were blessed, I think, throughout the summer in Summit County that our virus numbers were low, and we kind of got into a routine that things seemed to be okay here, and now that's not the case.
Yeah, we're gonna talk a little bit later with Thomas Davidson about enforcement around the public health order, but let's talk a little bit about the local public health order. So we of course incorporate what goes on at the state level within our order here locally, but then we have some other specifics locally that are maybe more strict than the state rule.
Yes.
And so you want to talk a little bit about what some of those most recent changes have been, and of course I want to hesitate for just a second with everybody and let everyone know, although we talk about what the order is today, it could change tomorrow, it could change next week, it should change in the next couple of weeks. And it probably is more likely than not going to change. And so you have to keep track of what's going on, take a look at the county's website to see the latest information. But we'll talk a little bit about what we've put into place most recently.
Yeah, good point. So today, as Scott said earlier, is Monday, November 16th. And so currently, we have restrictions on gathering sizes. That's above and beyond. So how it works, and we haven't talked about this in a long time, but it's the most restrictive order that takes precedence. And the state, a one-size-fits-all approach is really, really tough. And so I would say, in conjunction with the states, and also, our public health director, Amy, knowing what's best for our community, we've added these additional restrictions. And so local gatherings, no more than 2 households and no more than 6 people. And that's tough, especially when you have families that have been getting together for a while, breaking up those quarantines. Teams. And so no more than 6 people from 2 households. STRs are no more than 10 people. So I think Amy gave a really good example of why that is. Do you want to share that? I thought it was really helpful the other day.
Yeah, so the, again, concerns that we have are generally around our local population and the transmission of the virus here locally. Those folks that are at STRs are generally more self-contained, and so we don't have quite the same level of concern around transmission. And we, again, some people have said, and those numbers don't count against our numbers, but that's really not the issue that we're trying to address. We really are trying to look at specifically where have we seen transmission concerns. And our local population is where we're seeing a lot of the gatherings that are much greater in size, much more diverse in terms of the number of households that are involved. And so that's where the focus has been in terms of what we're trying to do. The gathering size is really an item that is part of the state order that we've tried to clarify and make clear to short-term rental property owners and property managers that it does in fact apply to them as well, to try and make sure of that.
So there have been anecdotal events lately of STRs that maybe have more people than that. We're following up on every tip. Our towns are working in conjunction with us when we hear about these sort of things. And we do want people to call that in to non-emergency dispatch on those sort of things. That number is 970-668-8600. And so we're asking people to follow up on those tips. But yes, our groups, we're not putting value over our visitors more than our locals. We have to go off the science and data, and those visitor groups in STR usually are more insulated, right? They're staying in that home that maybe they rented. They're not spread out as in the community as much like our locals are. And so also we have a local public health order that ends gatherings after 10 p.m. Other places did a more restrictive curfew. This is just a cease on all gatherings after 10 p.m. to really help lower that socialization, where we know later in the evening people tend to hang out longer and the virus spreads. Whether or not alcohol is involved, we usually find out that it is once our contact tracers start digging into that. And so with it, restaurants, we're saying no consumption of alcohol past 9:30 p.m. That's also distribution, serving. So it's just anything. You can't be drinking alcohol or serving it after 9:30 p.m. And so that is to allow people time to finish up that meal, get out of the restaurant, be home, etc. by 10 p.m., which is no gatherings. This is not a promise that it's helping with maybe those teenagers and things like that, but we're certainly hoping, as my dad used to say, nothing good happens after midnight. I think that that's true during COVID as well. Nothing good happens after midnight. So, we're not trying to vilify anyone in this. It's just what we're really trying to do is support our season and make sure that we have a strong economy when it matters. And so what we can do to take care of our locals, tamp down the virus, these are all just little things. And you've heard, we've talked about it here, being surgical in our approach. This is just yet another example of trying to be surgical there.
And the one other item that we clarified or that we modified in our local order, and that's around critical retail businesses, which most folks or most applicable in this particular case is grocery stores, and trying to, again, clarify capacity limits associated with grocery stores.
Yes, that is always a tough one. If there's one complaint that's been consistent from the very beginning to now, it is how crowded it is in grocery stores. We've complained about this as locals here in Summit County for years and years, but why does a group have to all go to the grocery store at the same time and take up the aisle, but especially during COVID? And so, we encourage grocery stores to ask their customers to limit party size and really have the essential people shopping, and also limit the number of people in the store. That is based upon square footage, how many people they can hold via our physical distancing protocol form. So we're at 50% capacity at grocery stores, retail, those essential businesses right now. We feel that that's fair, that it still allows people to do their shopping business, but hopefully tamp down on those crowds as we move into the holiday season, and these restrictions could very well be different before then. But there's those long lines that back up of people waiting to check out. That's not safe. There's not room necessarily to have that many people waiting to check out and that many people shopping on the aisles. And so this is really in response to, I would say, something our locals have been really outspoken about.
And the other piece that we've encouraged within the local order is the idea of using the online sales and pickup services that the grocery stores have as well. So where those are available, take advantage of those. Then you don't have to add to the capacity number in the store. You don't have to interact with folks directly, and it can be a contactless experience. So we'd encourage you to take advantage of that. All right, so that's the update that we wanted to provide around COVID. We'll talk, as I said, in the next segment with Thomas about enforcement and some other things around COVID. So again, thank you very much, Elisabeth.
Thank you.
Take care.
Yeah, thanks, y'all.